5 more persons have tested positive for COVID-19 in Meghalaya. These 5 individuals who have returned from Delhi and Haryana are asymptomatic and are currently admitted at Corona Care Centre in Shillong. With these 5 cases, the total number of active cases in the state have risen to 7. That's right, viewers. Big story that we're tracking at this point in time. 5 more persons have tested positive for COVID-19 in Meghalaya. These 5 individuals had returned from Delhi and Haryana and are currently stated to be asymptomatic and undergoing treatment at Corona Care Centre in Shillong. Well, with these 5 new cases, the total number of active cases in Meghalaya have risen to 7. And furthermore, on the 25th of May, a person who had travelled from Chennai along with the 14th positive case of the state also turned out to be positive for COVID-19. The person was kept under isolation since the day of his arrival. That's right, viewers. Another breaking news, another big story that we're tracking at this point in time is that 5 persons have been tested positive for COVID-19 in Meghalaya. These 5 individuals had returned to the state from Delhi and Haryana and are currently stated to be asymptomatic. They are currently admitted at Corona Care Centre in Shillong, and with these 5 new cases, the total tally of active cases in Meghalaya currently stands at 7. And to give us more details regarding this, I'm being joined now live from Shillong by my colleague Roshan Rai. Yes, Roshan, definitely big story this, with 5 more individuals testing positive for COVID-19 in Meghalaya. All 5 of them are of course returnees from Delhi and Haryana. So what are the latest details you're receiving at this point in time, Roshan?
Yes, Ronak, 5 more tested positive, and this was informed by Chief Minister Conrad Sangma in a tweet late yesterday night. And yes, these are returnees from Delhi and Haryana, and they are under quarantine in the Corona Care Centres. And yes, it was also informed that they are asymptomatic and they are said to be stable and doing all fine. And yes, this is something on anticipated lines, because as going through by what is happening all across the country, most of the cases that are testing positives are returnees. And so is the case with Meghalaya, and this 5 have tested positive. And if we remember, the other 2 also in Meghalaya who had tested positive, they were returnees from Chennai. So all in all, the total number of active cases in Meghalaya right now stands at 7.
Yes, indeed. Well, Roshan, how is contact tracing of these 5 individuals currently going on, and have the primary contacts of these 5 individuals been traced?
Yes, Ronak, I would say yes, because as we see, a different yardstick is being applied while dealing with people coming from outside the northeastern states. Earlier, they would be brought in to various centers for screening, testing, and all of that, and later on it was decided. But now what is happening is they are straight away being brought to the various quarantine centers where they are kept for 3 days, where their samples are taken. They are made to go through the 3 line of testing, that is thermal, then rapid test, rapid diagnostic test, and then also the RT-PCR test, which is said to be more accurate. So after all of that, this comes out. So basically, what I'm trying to say is, all those people who are being brought into the state, everybody has to go through this mandatory line of testing. So obviously, they are all being quarantined and tested.
Right. Roshan, definitely, as you rightly mentioned, all the states are currently witnessing an influx of returnees to the state. So how is the government of Meghalaya currently planning on dealing with this current situation, Roshan?
Yeah, apart from the testing and all of that, because all we see is, of course, the testing is going on. 3 layers is there. The testing facilities has also been ramped up in the state from 90 a day say the RT-PCR testing, it has gone up to 400, 500. And there's also the facility of pool testing that has been introduced, which gives much more better and faster results. So all of this is in place on one side that the government is doing. While on the other, the government is also trying to reach out to all the communities at different levels and also make use of the various community quarantine centers and the educational institutions that will be converted into quarantine centers as and when the need be. And apart from that, over 7,000 COVID community committees have been set up at various localities and villages. So these are to monitor those who have been sent for home quarantine at all levels. And apart from the COVID-19 team, the COVID task force of the government, these are the various community level preparedness, and they will take care of all of those. So, of course, different checks and balances have been put into place. Now we'll have to see how it goes from here.